Don't worry, we will discuss everything, but what do you want to specifically discuss? Okay, lung. Lung cancer, there's nothing more, okay? The small thing you should know, okay? Very small thing. Doctor, where do the management of colon cancer? Doctor, for colon cancer, please do the e-medicine questions. Then you will get an idea, okay? Because there's no proper guideline for colorectal cancer, but we have a guideline for post colorectal cancer screening. Okay, so my preference is here also. You can see they have like mentioned so much things about the colorectal cancer. Yeah, I got screening from this colorectal cancer point. So here you can check it. Okay, so yeah, okay. For the lung cancer, we have to screen. There's nothing more, okay? Nothing more, but small point you have to remember here. Is that, yeah. Here, for the lung cancer screening, this is from Cancer Council Australia, okay? Yeah, then you should know who is eligible for a screening, okay? Who is eligible? So, lung screening is for those most at risk and eligible of lung screening. Here, age between 50 to 70, and if the patient smoke cigarettes, it, if the patient is smoking cigarettes or have a history of cigarette smoking, having quit within last 10 years, okay, last 10 years. And if the patient is having history of tobacco cigarette smoking at least 30 pack years, for example, a pack a day for 30 years or 2 packs a day for 15 years. And if the patient don't have any symptoms of lung cancer, anyway, we are doing screening for asymptomatic people. So you should know the time, the age 50 to 70, and patient should have the history of cigarette smoking, even though patient is quite within quite within the last 10 years, okay? And patient, the history should be at least 30 packs years. That means a 1 pack for 30 years or 2 packs for 15 years, and don't have symptoms of lung cancer. Then here how we should do the lung cancer screening. Yeah. Usually we are doing here. 1 minute. In here, the screening, for the screening part, we use free low dose CT scan. So, what we should use? A low dose CT scan. Okay. So, in this patient, we have to do the CT scan. For how long? Now, they have changed this part. Okay. Give me 1 minute. Usually, it's for 2 years. How?
We use low dose CT scan from age 50 to 79 years, I
Yeah.
guess, doctor.
50 to 70, yeah, doctor. Here they have mentioned. I'm just searching for the time period because in previously, they have changed the guideline. Usually, in previous guideline, how does lung screen work? they have mentioned this Lodo CT screening for 2 years. Okay, 2 yearly, every 2 yearly. I'm just finding it. Where is that mentioning? Symptom. Mhm. Let's check the same thing they have mentioned. I want to show that 2 year where they have mentioned. Actually, can't find in here, but in previously in this website for in Cancer Council, they have mentioned. If you have my notes in the group, I have pinned that one, not the pin. I have reply for that notes as well. In there, I have added the exact one from the Cancer Council. Okay. Yes, I will upload Dr. Yesterday one. But I can't find here. I didn't even see. Okay, let's do some emergency questions for lung cancer screening. I think then we will find it. Otherwise, I have one minute. I'll show my note. You know, that's the thing in AMC. They are usually changing something because I made this note in last year. Here they have mentioned eligible Australian will able to have free lung scan low dose CT every 2 years. The same eligibility criteria they have mentioned. So please remember this one as well. Okay, this is my note. It's kind of messy because this is the previous guideline. Okay, in previous guideline they have mentioned about the colorectal cancer. The age is 55. Now it's 60. Okay, yeah, same thing. Okay, let's do e-medicine. I have to renew my subscription. Okay, we got one question. Good. Okay, so a 58-year-old man present to the GP clinic for routine checkup, and he has no significant medical history and take no regular medications. He worked as an accountant and reports smoking one pack of cigarettes per day for 35 years. And he has no respiratory symptoms on examination. He appears well with vital signs within normal limits. CVS is unremarkable. Then, which one of the following is most appropriate management? So, not manage, yeah, management. Next step. So, what do you think, doctors?
Low dose CT scan.
Mm-hmm. Okay, let's check if they have mentioned in here the time period. Yeah. The patient meets the criteria for lung cancer screening, which commenced on the 1st of July 2025, Australia. He's 58 years old, between 50 to 70, and he's asymptomatic and has a 30 pack year smoking history. One pack per day, right? And current smoker with this level of exposure should offer screening, right? Then refer for the low dose CT scan is the recommended screening test for lung cancer in high risk individuals. Studies have shown that 2 yearly low dose CT screening can reduce the lung cancer mortality in this population. The National Cancer Screening Registrar will notify the patient of a reminder for the repeating scanning here 2 years time if the initial scan reported as normal. Okay, so here you can confirm it 2 yearly screening, right? Yeah. Same thing. Let's check their reference. Yeah. When I can't find some references, I usually do that. Okay, if I want some good references, I use the e-medicine references part. Okay, then you can find it. Okay, here let's check. Okay, the same thing they have mentioned. Mm-hmm. Mm-hmm. Same thing, doctors. Yeah, screen again in 2 years, right? Yeah. Here they have a cute chart. Yeah, that's all for here. Mm-hmm. Okay, then they have mentioned something here. After you scan, the radiologist will review the image and to result in national cancer screening or something. Okay, national, yeah, and send them to your healthcare provider and receive communication from the NCSR explaining your next step. So it depends on what's found during the screening. Going back to the healthcare provider to discuss the result and booking another follow-up scan if needed. Result will not able to directly to you as they are sending healthcare provider. Okay, then if your scan has if you may need another scan in 3 months, 6 months, and 12 months, or continue scanning into 2 years, it may also mean getting in the referral from the respiratory physician. It's depend on the GP's review doctor, but usual screening is every 2 yearly, right? Every 2 yearly, yeah. And we don't need to, yeah. Yeah, doctor, that's all for here. Mm, yeah, okay. What is in the chat? Yeah, you all know it's a very simple part, the lung cancer one, okay? So you don't have to worry about it, the lung cancer part, okay? I have to stop the recording for lung cancer. So remember the eligibility criteria and what we should do is low dose CT every 2 years.